Hi, this is Senator Ed Markey, and thank you all for joining us today to talk about trans health equity and the importance of greater access to trans healthcare like testosterone treatment. So I'm going to be with Chase Strangio, the Deputy Director for Transgender Justice with the ACLU's LGBT and HIV project, and one of the leading experts in the world on transgender rights. So, Chase, thank you so much for being here.
Thank you for having me. It's great to be with you. Massachusetts is my home state, and so I am very pleased to be speaking with you today.
Beautiful. Where did you grow up, Chase?
I grew up in Newton, and my family is still in the Boston area, and I go back regularly.
So, what high school did you go to, Chase?
I went to Newton North High School. I graduated in 2000, and yeah, I went to.
What did you do then?
And then I went to Iowa for college. I went to Grinnell College in Iowa, and then I came back to Boston and went to Northeastern for law school. So I've spent most of my life on and off in the Boston area, and consider myself Massachusetts through and through. So happy to have your leadership in this area. And obviously, when I was growing up, it was a different time, but really good to see your representation of our communities.
Yeah, so I can see where I've been to Grinnell, so that's an
Oh.
incredibly progressive school. And then Northeastern University Law School, that's a hotbed of activism and progressivism, huh? So you really put yourself in a situation where you've been exposed to some of the biggest ideas and how to advance them.
Yeah, I mean, I think when I think about my education and coming out of, I went to the Newton public schools. They're some of the best public schools in the country because it's a wealthy neighborhood with obviously tax money going into the public school system. So I benefited greatly from that. And then went and studied history at a very good school, and then went to law school as well at Northeastern, which has a orientation towards thinking about the law. And so when I think about my career and the work that I do, it has 100% been informed by the education that I was able to even and sort of thinking critically about how our government works, how our resources are distributed, and how I connect to my community.
Well, we're so lucky that you are willing to dedicate your career to this fight. Uh, I I sent a letter to the Biden administration last month asking them to lift barriers to testosterone and expand access to gender affirming care. Um, and my goal is to make sure that I continue to advance that goal. So, Chase, I would love to hear why you think it's important for the government to take action to expand access to testosterone.
Yeah, I mean, I think so. First and foremost, what we're talking about here are medications that are being prescribed by doctors consistent with guidelines that are supported by every major medical association. And unfortunately, as I've experienced in my life, as many trans people have experienced in their lives, getting access to supportive doctors and the care that we need is incredibly difficult, even in places like New York, where I live, and Massachusetts, where I'm from, places that are understood to be more progressive and have less discrimination against trans people. Getting access to care can be exceedingly difficult, and there are a lot of barriers. And this is care that greatly improves the mental health and well-being of transgender people. And so, with respect to the scheduling of testosterone, for example, obviously that makes it a lot harder to get the medication. It means you often have to go to in-person visits, which have been waived in light of COVID relief on restrictions. But again, these are ways that it make increase barriers in an already very difficult context. And one thing I will say is that when we have a lawsuit against the state of Texas because they have done what I consider to be one of the most egregious things in this area, which is to deem gender affirming care to be a form of child abuse. So in essence, authorizing the state child protective agency to investigate families who are following the advice of doctors to treat their adolescent children. And in the litigation in that case, one of the things the state routinely brought up was that that testosterone is a controlled substance, as if somehow giving and consenting to treatment that happens to be controlled substances is automatically a form of child abuse, which of course it is not. But also, it just was a way in which the state was using this fact to justify their incredibly intrusive and dangerous intrusion into families in the state of Texas.
Yeah, beautiful. And again, I'm from Massachusetts. You're from Massachusetts. So you know that we're not perfect. And we have a lot of work to do. But what Texas is doing is just absolutely beyond the pale. And what my letter asked the Biden administration to consider in the rescheduling of testosterone from a Schedule 3 to a Schedule 5 drug, or descheduling it entirely, what would you say to someone who is curious or nervous about descheduling testosterone and removing it from the Controlled Substance Act so that it's more accessible to people, so that it's not a big headache trying to get access to it? The whole idea of even figuring out what is a schedule, and what number is it? It's a Schedule 3 or a Schedule 5. What's your um, take on what we should be doing to even go further, just remove it from the Controlled Substance Act?
Yeah, I mean, I think your letter is incredibly helpful because, in essence, it points out a few different things which are very important. The first is that even when it was added to the schedule, to the scheduling by Congress initially, there was a lot of opposition from the medical community that it didn't make medical sense to do this, and that at the time it was related to the unauthorized use of testosterone in the context of cisgender athletes. And of course, now we have this impact that's being extended to the trans community. And so when it's being prescribed for the indication that it's currently being prescribed for, again, for trans individuals who are receiving it as part of their gender dysphoria, recognized by every major medical association, it doesn't have addictive properties at all. And doctors recognize that. And so, when we're talking about what is the way in which this is done in the first place, even at the outset, this was not something that the medical community supported. And now we have these sort of spillover effects onto the trans community, which really hinder the ability of people to access this care. And again, there's already so many barriers to getting treatment. I think one of the really disturbing things about the public conversation right now is there is this assumption that this care is incredibly easy to get, that you can just walk in to a CVS and ask your pharmacist and you'll get it that day. This is highly regulated set of procedures that you already have to go to a doctor. You already have to have access to insurance for the majority of people. And you already are contending with the reality that trans people face so much discrimination in healthcare that is preventing them from getting into the doctor's door in the first instance. And so any barrier like this one is going to make it that much harder, which in essence is just going to push people into the black market, which has such high risk associated with it. And so when we're thinking about this healthcare generally, I think what you're doing is exactly right, is to ask, how can we limit the barriers that this community is facing to access the healthcare
Okay,
that
so
they need?
Chase, talk about two things that you've just raised. One is the research on the addictive nature of this. Okay, and I thought I heard you say that. And what is that research?
Well, I'm not aware of any research, and I think that's the important point, is that this is not something that is being exploited in such a way that needs to be regulated pursuant to the Controlled Substances Act. This is something that is being prescribed consistent with medical guidelines, and it, has really no association with the initial concerns about testosterone back when it was added to the scheduling by the DEA. And so here, what we have is what the research shows is that this is a medication that is prescribed by doctors for a medical indication, which is gender dysphoria, and when it's prescribed, it is taken consistently with those recommendations and it improves health outcomes for the trans community. So, that is what's happening. And when you look at the other medications that are used to treat gender dysphoria, estrogen, testosterone suppressants, and puberty blockers, they're not controlled substances. So when we're looking at the ways in which various pharmaceutical treatments are used in this area of care, it's only testosterone that is considered a controlled substance. And that's because of the impact of the prior regulation, which was in a totally different context. And again, even at the time was opposed by the medical community.
So thank you for making that.
Or, in such a way that needs to be regulated pursuant to the Controlled Substances Act. This is something that is being prescribed consistent with medical guidelines, and it, has really no association with the initial concerns about testosterone back when it was added to the scheduling by the DEA. And so here, what we have is what the research shows is that this is a medication that is prescribed by doctors for a medical indication, which is gender dysphoria, and when it's prescribed, it is taken consistently with those recommendations and it improves health outcomes for the trans community. So, that is what's happening. And when you look at the other medications that are used to treat gender dysphoria, estrogen, testosterone suppressants, and puberty blockers, they're not controlled substances. So when we're looking at the ways in which various pharmaceutical treatments are used in this area of care, it's only testosterone that is considered a controlled substance. And that's because of the impact of the prior regulation, which was in a totally different context. And again, even at the time was opposed by the medical community.
So thank you for making that clear. So in addition to testosterone access, we've recently seen an onslaught of shameful threats levied against Boston's Children's Hospital and other providers of gender affirming care in our hometown, Chase.
Yeah.
So what else? What else should we be doing to protect access to trans health care for both young people and adults? And how can we stand up to these threats?
Yeah, I mean, I think a few really important things to note here. I mean, the first is that what we're seeing now in the escalation of attacks on medical providers treating their patients consistent with medical guidelines looks a lot like the playbook in the abortion context. I mean, I grew up right next to Brookline. There was an attack on the Planned Parenthood while I was growing up. This
Right.
is exactly the type of saw and continue to see in the context of abortion providers. This idea that you have an opposition to a type of treatment focusing on the providers and escalating threats through misinformation of what's happening in these clinics and how it's happening. So right now we have these threats being imposed on gender across the country. These are genders, many of them housed at children's hospitals or research institutions affiliated with universities that have highly trained professionals that are conducting critical research into this treatment as well as clinical care to patients. And I think what is so terrifying is that we are unfortunately engaged in this public conversation debating this care when the medical community is using their clinical experience and their research to develop best practices, and that continues to be disrupted by now these threats and these attacks legislatively. And it is deeply concerning. And I think one of the that both the legislative bans and these sort of threats directly to gender clinics that we're seeing is that it really highlights the hypocrisy. On the one hand, you have opponents to the treatment saying, we don't have enough research, we need more data. And then on the other hand, making it a crime to provide the care itself. How are we going to research any of this if it's a crime to provide the care? So, what they really want is to stop people from being trans, to disrupt this treatment. And now, what we're seeing is in the process of doing so, threatening the provision of medical care in children's hospitals altogether, which is terrifying.
Yeah. So I saw your recent tweet about your own experience with top surgery, and you share how you have never regretted it, but that you've often regretted a knee surgery that you've had. So, how does your experience exemplify the need for greater access to trans health care? And could you also talk about the harm that bad faith framing of gender affirming care, as regrettable, has for the community?
Yeah, I think one of the things that we have to sort of tap into and take a step back, the opponents of this treatment use a lot of scares and a lot of scary concepts that just unfortunately happen to be true of all of medicine. It is just simply true that in medicine, there are often gaps in data and research. It's especially true in pediatrics. I'm a parent. I know that every time I go to the pediatrician and I have questions, there's just information that we simply don't have. And that's you take a leap of faith. And what you do is you trust your doctors. And like in the context of much of pediatric medicine in the area of treating transgender adolescents, we don't know everything. Of course, we don't know everything, but we know a lot. And so I think what's really hard is we have these incendiary talking points like there's not enough data. The data is weak. This is irreversible and sterilizing that people regret. And again, that's much of the treatment is completely reversible. Much of the treatment is not sterilizing. So these are broad concepts being applied. People have reflexive reactions, but they're not true at their core when we investigate them, nor are the critiques limited to critiques of medicine for transgender people. We could apply them across the board, which is why I brought up my knee surgery, which is to say, I had top surgery when I was in my 20s. I would have loved to have had it earlier. It was hard enough to get when I was in my 20s. I spent years trying to save up the money for the treatment, as well as try to figure out how to make it happen at a time when it was even more difficult than it is now. Although what we're seeing is it's getting more and more difficult again. Whereas when I had knee surgery at Boston Children's Hospital, in fact, which is an incredible hospital, I had an incredible surgeon. But the reality was I was young. I didn't know that there would be lifelong impacts to this surgical intervention. My parents were given the best information that they could have been, but ultimately, I have way more side effects and complications from that knee surgery that I had when I was 14 years old than I do from my top surgery. And I think that the problem is that we have these stories of regret where you hear from one or two people, or even 10 or 15 people who regret the treatment that they received. And there's just simply never going to be a medical intervention that some percentage of people regret. It's an incredibly low percentage of people. But what we're unfortunately seeing is people's experience, tragic as it is, being weaponized in the service of categorical bans on this treatment for everyone.
Yeah, no, thank you for that. And we know that gender affirming care is central to trans people's health, well-being, liberty, equality, freedom. It's gender and life affirming, and we just have to go out to the cutting edge in order to make sure that that's the case. When I was a state representative 50 years ago, we had an amendment that said you cannot be fired in Massachusetts as a state employee if you're gay. and we lost in Massachusetts just on that issue, whether or not you can be fired. Okay, and so, and we've come a long way in Massachusetts, but we still have a long way to go. Back in 2019, in May of 2019, I introduced a bill in Washington, the Gay and Trans Panic Defense Prohibition Act, so that we could actually begin to debate on whether or not people can say, "Oh, you know, yes, I killed that person. Yes, I beat that person up. But you see, I panicked because I found out that the person trans or the person was gay, and that just can't be a legal defense, right? Nationally, and so we just have to keep, pushing out the boundaries of where the protections are. Who is entitled to all of the full protections under the 14th Amendment of the United States? Equal protection for all. And so we just continue to push the outer boundaries to make sure that that is the country that we live in, that we're a more perfect union. We keep trying to perfect it even more. And that's why we really, appreciate all of your great legal work. And related to that, Chase, you were part of the legal team representing uh, the late Amy Stevens in the Supreme Court's very first case on transgender rights. Can you talk about that case and what Congress should be doing to protect the rights of trans people across this country, including at work?
No, yeah. So thank you for that, and thank you for your leadership. Again, I mean, we absolutely need people to continue to push the bounds, to continue to make it clear that we simply can't tolerate the types of explicit discrimination that this community continues to face. And in the context of Amy Stevens' case, which did go up to the Supreme Court alongside two cases involving gay men, Amy was fired because she's trans, and the gay men were fired because they're gay. And in each of the cases, there was a simple before the court, which is, does Title, which is the federal law that prohibits sex discrimination in employment, prohibit discrimination against someone for being LGBTQ? And courts, lower courts, have for many years held that, in essence, of course, it's sex discrimination to fire someone for being gay or to fire someone for being trans, because let's say you fire someone because they come to work and they talk about their spouse. A man comes to work, talks about their male spouse, they get fired. But a woman could come to work, talk about her male spouse, she wouldn't get fired. Sex discrimination. And similarly, on the trans side, you come to work, say, I'm a woman, I'm going to dress as a woman, but you're assigned male at birth. But they would let some female at birth come to work, say they're a woman, dress as a woman, and they don't get fired. And so, again, those are simple but for sex discrimination. Courts had increasingly found that to be true. And this was the question teed up before the United States Supreme Court in 2019. They ultimately decided in 2020, thankfully, that Title VII did prohibit discrimination against LGBTQ people as a form of sex discrimination, which has obviously huge impacts because there are many federal laws that prohibit sex discrimination, but there are almost none that explicitly prohibit discrimination against people for being LGBTQ. We continue to have that gap in the law, and this was an incredibly important legal holding to ensure that while there is no explicit reference to sexual orientation and gender identity in federal law, that the prohibitions on sex discrimination do in fact cover protections for LGBTQ people.
Well, you know what, Chase? We couldn't win in Massachusetts 50 years ago in stopping gay people from being fired as state employees. Excuse me. And you go to the Supreme Court and you win this historic case in 2020. So that's how far we've come. And you've been a great leader. And, Eleanor Roosevelt used to say, I do not see what has been won, but only what has yet to be won. So there are fights ahead. There are new battles that still have to be waged. And we know that the barriers to healthcare are intersectional. So can you talk through the ways that barriers to medically necessary care for trans people might disproportionately harm Black and Brown people as well?
Yeah, I mean, if we think about the nature of healthcare access in this country, a country that has systemic anti-Black racism, systemic racism across the board, where health access is already constrained for communities of color, for immigrant communities, for disabled communities, we're talking about a system that is pushing people out of effective care as a general matter. We don't have widespread insurance coverage. We have widespread unemployment in the trans community that is much higher in the Black and Brown trans community because of cutting racism and transphobia in the workplace. And unfortunately, because we tie health coverage so often to employment, we have more people who are unable to access quality health care, particularly in communities of color, Black and Brown trans people being pushed out of safe, affordable health care. And so, what that means is that when we have these increasing restrictions on care for communities, it's going to impact those communities that are already facing the most discrimination in the health context, which are disproportionately Black trans people, disabled trans people, and people who have, because of their geographic location, because of poverty, because of immigration status, are more marginally situated when it comes to accessing care. And so these are incredibly important fights for the entire trans community, but particularly those members of our community who are pounding structural discrimination.
So how do you, Chase, how do you envision a healthcare system that would be fully inclusive of trans people? What would building a trans inclusive healthcare system mean to the communities most impacted by the existing barriers?
Well, I mean, I think it's important to think of it in two ways. There's first the way in which we have to improve health access generally. We need single payer healthcare. We need to improve government programs to provide care for people who have been historically excluded from care systems. That is first and foremost the most impactful way to reach everyone, which is why things like student loan forgiveness are trans related. Things like expanded healthcare access are trans related. So that's one of the ways that I think about this. A truly inclusive trans health system is a health system that provides care for more people, first and foremost, because that's going to be the single most important way. Expanding Medicaid, increasing access to care generally important, critically important for trans communities, particularly trans communities of color. And then I think we need to continue to have robust interpretations of the Affordable Care Act's non-discrimination provisions, which already prohibit discrimination on the basis of sex and healthcare. So we continue to need to push the administration to have robust interpretation of that prohibition to ensure that LGBTQ people are not facing discrimination in healthcare. And I will note, when we talk about trans access to healthcare, we often associate it with gender affirming healthcare. And that is critically important in an area where people routinely get suboptimal care or no care at all. However, the reality of discrimination in the trans health context go far beyond gender affirming care. And so many trans people are denied care altogether. They are pushed out of gynecologist office. They are denied emergency room care and face discrimination in a host of contexts. So we need to think about this care holistic.
The existing barriers.
Well, I mean, I think it's important to think of it in two ways. There's first the way in which we have to improve health access generally. We need single payer healthcare. We need to improve government programs to provide care for people who have been historically excluded from care systems. That is first and foremost the most impactful way to reach everyone, which is why things like student loan forgiveness are trans related. Things like expanded healthcare access are trans related. So that's one of the ways that I think about this. A truly inclusive. That's one of the ways that I think about this. A truly inclusive trans health system is a health system that provides care for more people, first and foremost, because that's going to be the single most important way. Expanding Medicaid, increasing access to care generally important, critically important for trans communities, particularly trans communities of color. And then I think we need to continue to have robust interpretations of the Affordable Care Act's non-discrimination provisions, which already prohibit discrimination on the basis of sex and healthcare. So we continue to need to push the administration to have robust interpretation of that prohibition to ensure that LGBTQ people are not facing discrimination in healthcare. And I will note, when we talk about trans access to healthcare, we often associate it with gender affirming healthcare. And that is critically important in an area where people routinely get suboptimal care or no care at all. However, the reality of discrimination in the trans health context go far beyond gender affirming care. And so many trans people are denied care altogether. They are pushed out of gynecologist office. They are denied emergency room care and face discrimination in a host of contexts. So we need to think about this care holistically and also expand access to healthcare more generally in this country.
Well, can I say this, Chase? First of all, thank you for using your Northeastern University Law School degree to win a case in the Supreme Court of the United States to further expand freedom and equality in our country. Thank you for that. Further expand freedom and equality in our country. Thank you for that. Just and again, just one of the many, many, many contributions that you've already made and that you're going to make in the future. Thank you for your great leadership. So as we wrap up, what is your final message to people listening today?
I mean, I think my final message is that our freedom and our legal protections are all tied up together. And so, if people are concerned about abortion access, if people are concerned about voting access, people are concerned about trans rights, these things are all connected, particularly as we approach the midterms, as we approach the 2024 presidential elections, and that ultimately approach the midterms, as we approach the 2024 presidential elections, and that ultimately we have to have concerted fights that are collaborative. We got to work together to fight back against discriminatory policies, discriminatory legislation. And when they come for trans healthcare, it's certainly not going to stop there. Just like when they come for access to abortion, it's not going to stop there. And so we really have to be on our toes as we look at this next series of years in a fight against some really scary things that are coming down, particularly from state governments across the country. And so I hope that we can work together to expand justice for everyone, because people's rights are significantly and devastatingly curtailed in this country. And hopefully we can create better conditions for people to live more freely.
Well, thank you, Chase. And for anyone who's listening, we need to continue to be consistent, persistent, insistent that all of the protections of the United States Constitution and our healthcare system are given to the trans community. And to everyone who's listening, thank you for everything that you're doing in order to advance this cause. Thanks for joining me today. Uh, we just have to say it loudly, clearly, that trans rights are human rights. And I look forward to working with you, Chase, and with everyone listening, to working with trans people across the country to win these fights. So thanks you, Chase, and thanks to everyone for listening.